Hi, I'd like to spend a few minutes of your time today discussing electronic health records and how they might impact Maven Manor. An electronic health record, or EHR, is a digital version of a patient's paper chart and a storage system for patient data. HealthIT.gov states EHRs are real-time, patient-centered records that make information available instantly and securely to authorized users. The EHRs include patient documentation of medical history and treatment plans, but they also include much more. They contain progress notes, medical history, medication history, lab results, radiology images, and demographic and insurance information. Some EHR systems go so far as to include office workflow software, as well as allowing appointment setting, billing, insurance submissions, and prescription refill management. They also provide evidence-based decision-making tools to help with patient care. The EHR has the capability to become the hub of office and patient management activities, as well as an amazing source of data at the population and individual patient level. Let's highlight a couple of ways EHRs can support the clinical care provided to our patients. They can easily summarize member health information, including medications, vital signs, complaints, lab results, and other pertinent health information in one screen. Some of the benefits of this quick look at patient health information include a more comprehensive look at the patient's health status and condition in one spot that is updated every time you open the chart. It's easy to see contraindications or multiple issues or concerns that might impact the treatment plan and decisions. And predictive modeling can be run using data entered into the EHR to assist in treatment plan development and adjustment to improve healthcare outcomes. As we know, nothing is perfect. In this situation, there are a few concerns that would need to be addressed. The information is only as good as what is entered. There needs to be a consistent standard of entry so that the information is entered the same way with the same expectations, no matter who in our facility is performing the entry. Electronic storage and access requires security measures that must be followed to avoid HIPAA breaches, not just by leaving the paper out in the old days or the screen locked in the instance of EHRs, but to control the flow of digital information on the information superhighway. Information must be stored and protected from these breaches. Another component I'd like to highlight is the transfer of information. As stated on Practice Fusion blog, EHRs are built to share information with other healthcare providers and organizations, such as laboratories, specialists, medical imaging facilities, pharmacies, emergency facilities, and school and workplace clinics, so they contain information from all clinicians involved in a patient's care. Basically, they're designed to go where the patient goes and to be accessible to anyone involved in the patient's care, including the patient. The benefits of this sharing are plentiful. The record includes a complete view of the patient's history in all treatment plans, medications, surgeries, etc., not just ours. This allows for better management of patient condition, as well as better communication between all providers. EHRs with information from various providers on multiple patients of our facility give us more data to use for our population health reporting. We can use this universe of data to build decision support templates and have outcomes for different treatment plans of conditions. Costs are also greatly reduced as we reduce duplicate tests and labs, since data is already available from what another provider may have ordered. And patients and their caregivers can be more engaged in care with access to their records via the patient portal. Some concerns around sharing this information include sharing EHRs include interoperability between providers. This means their systems need to be able to talk to our system and vice versa. To do this, each system needs to meet national standards so that the information can be sent and received with other systems. Another concern, one word, security. We've all probably been part of a breach of electronic information where we shop or where we bank. That information is a lot easier for the thieves to use than medical information, which is probably why medical information hasn't become popular information to steal electronically. But that can change in a minute, and when it does, it can come with hefty fines as part of HIPAA. It's hard to guess what type of security is needed, but it's important to implement secure measures that meet minimum standard when implementing an EHR system. But that's not the end. We will need to stay on top of the ever-changing security approaches and update as necessary. Besides patient care, EHRs can also support a more efficient and less tedious administrative process. Documentation such as treatment plans and discharge plans, orders and prescriptions can be completed during the patient visit or contact. Again, there are benefits and issues that will need to be addressed. Orders and prescriptions can be printed or automatically sent to the appropriate provider or pharmacy. There's no longer a need to log into a different system or write out orders and prescriptions and have the patient take with them. EHRs also eliminate the need to record comprehensive patient records for transcription later. Basically, it can all be done right there at the contact. They create a more efficient process that benefits not only the facility, but also the patient, as the information is sent immediately to the pharmacy, the DME provider, home health agency, or other provider. The information is immediately available for any provider to view for future care. Standards and monitoring are very important to ensure all providers are following processes to enter information into the EHR. Otherwise, items may be lost as workflows become more EHR-centric. In other words, if a provider doesn't enter a prescription directly into the EHR but chooses to do it later, there's not going to be a whole lot of backup to make sure that that does get in. So we'll need to be on our game to make sure that information is entered at the time it's supposed to be entered. EHRs can also support the administrative process by handling all aspects of billing. How does this help? Codes for which to bill will be more readily available as the physicians and nurses document time spent and actions taken in the EHR during patient interactions. Insurance claims and submissions and reimbursements can be done through some EHR systems, providing an immediate snapshot of outstanding items, denied claims, and patient responsibility. Reports can be run on a variety of metrics, including outstanding balances and trends on claims payment and volume, and reasons for denied claims. What are the concerns that need to be addressed? Interoperability is again a concern. If our system and the insurance system can't interface, the information can be compiled in our EHR, but another process will need to be followed for the submission and receipt of information back from our payers. This will lead to administrative inefficiencies and possibly additional errors, as we have to use multiple systems and backload information into our EHR. Capturing codes and updates to insurance information will require standards for entry across the facility. If the entry is not consistent, opportunities will be missed and require follow-up or rework. To gain the most benefit from EHR implementation, the administrative and clinical areas need to work together. I have mentioned as concerns of some of the components the need for consistency and standards. This requirement affects both the clinical and office areas. The teams will need to work together to develop the rules around consistency in EHR entry and use. Standards will need to be developed collaboratively and an oversight and maintenance program designed and agreed upon by both administrative and clinical areas of the facility. Another opportunity for integration will come with workflow changes that come with EHR implementation. Processes and the flow of information will change as we switch from paper shuffling to electronic sharing. This means handoffs of patients, bills, payments, and much more will change. There may be pieces of information gathering that currently only happen in certain contacts. They will be able to be handled in contact between the patient and any number of employees, since the information will be more readily available and more people will know what is needed. Another opportunity comes with tracking and trending. As an example, let's look at claims submission and payment. If the billing area runs a report to look at trends on why there's been an increase in denied claims with an insurer, They may need to consult the clinical areas on clinical guideline changes or new treatments that may not yet be covered by insurance. Another example is in predictive modeling for disease management. Our nurses may use predictive modeling to determine how to decrease falls that result in policy changes that need to be enforced starting at the front desk when greeting patients or when welcoming new patients. I could go on for a lot longer than you would like me to, but the point is an EHR implementation has the potential to lead to more integration among our departments, a safer environment where our patients experience better health outcomes, and better collaboration between all providers involved in treatment of our patients. Thank you for your time, and I look forward to speaking more about EHRs in the future.